Good day, everyone. I am Raloxifene and I am here today to talk about my autobiography. My generic name is Raloxifene. The brand names under me are Larthen, Evista, and Optrama. My drug classifications are: as a therapeutic drug, I am an anti-neoplastic. As a pharmacological drug, I am an anti-neoplastic and an anti-estrogen. My pregnancy category is pregnancy category X, and my origin is of biosynthetic sources. My mechanism of action are largely mediated through binding to estrogen receptors, which result in activation of estrogenic pathways in some tissues and blockade of estrogenic pathways in others. The estrogen receptor can regulate gene expression by at least two distinct pathways, which are ligand, tissue, or gene specific. Binding of raloxifene to the estrogen receptor results in differential expression of multiple estrogen regulated genes in different tissues. Similar to tamoxifen, I produce estrogen like effects on bones while antagonizing the effects of estrogen on mammary tissues. However, while tamoxifen stimulates uterine tissues, I produce nearly complete blockade of uterotrophic responses to estrogen and can antagonize the uterine stimulatory effect of tamoxifen. Bone loss is initially rapid because the compensatory increase in bone formation is inadequate to offset resorptive losses. My effects on bones are manifested as reductions in serum and urine concentrations of bone turnover markers, decreased bone resorption, and increases in bone mineral density. In postmenopausal women, I increase total body BMD, including BMD of the lumbar spine, hip, and femoral neck, and decrease fracture incidence. Similar to estrogen replacement therapy, I also decrease total and low density lipoprotein cholesterol and lipoprotein concentrations. However, estrogen increases high density lipoprotein, cholesterol, and triglycerides, while I have no effect on these lipoproteins. Unlike estrogen, I do not stimulate the endometrium in postmenopausal women with an intact uterus. I appear to act as an estrogen agonist in bone. I reduce resorption of bone and increase bone mineral density in postmenopausal women without stimulating the endometrium or breast tissues. Decreases in circulating estrogen after oophorectomy or menopause lead to enhanced bone resorption. My pharmacokinetics are as follows. In absorption, I am rapidly absorbed. Peak levels depend on systemic interconversion and enterohepatic cycling of drug and its metabolites. After oral administration, about 60% of me is absorbed. Absolute bioavailability is 2%. Distribution. Apparent volume of distribution is 2,348 liters per kilogram, independent of dose administered. Drug is highly bound to plasma proteins, both albumin and alpha 1 acid glycoprotein, but it doesn't appear to interact with the binding of warfarin, phenytoin, or tamoxifen to plasma proteins. Metabolism. I undergo extensive first pass metabolism to glucuronide conjugates. Excretion. I am primarily excreted in feces with less than 6% of dose, eliminated as glucuronide conjugates in urine. Less than 0.2% of dose is excreted unchanged in urine. My indications are: I am used by women to prevent and treat bone loss after menopause. I slow down bone loss and help to keep bones strong, making them less likely to break. I may also lower the chance of getting certain type of breast cancer after menopause. I am not an estrogen hormone, but I act like estrogen in some parts of the body, like your bones. In other parts of the body, I act like an estrogen blocker. It does not relieve menopause symptoms such as hot flashes. I belong to a class of drug known as SERMs. I am a medication that should not be used before menopause, and I should not be used to prevent heart disease. Contraindications: I should not be given if the patient has the following conditions: high amount of triglyceride in the blood, increased risk of blood clotting, a clot in small veins that carry blood to or from the retina of the eye, high blood pressure, coronary artery disease, a clot in the lung, atrial fibrillation, chronic heart failure, a transient ischemic heart attack, a type of stroke that lasts only a few minutes, a stroke, thrombophlebitis, an inflamed vein due to a blood clot in a deep vein of the extremities, liver problems, pregnancy, tobacco smoking, increased cardiovascular event risk, lupus, anticoagulant disorder, chronic kidney disease stage 3A, chronic kidney disease stage 3B, chronic kidney disease stage 4, and kidney disease with likely reduction in kidney function. Allergies for raloxifene and tamoxifen analogs. When I am taken, side effects such as hot flashes or leg cramps may occur. Very serious side effects, including signs of blood clot, trouble breathing, coughing up blood, sudden vision changes like blurred vision or loss of vision, signs of a stroke. A very serious allergic reaction to me is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, and trouble breathing. Nursing responsibilities. Before I am taken, the nurse should conduct a baseline assessment, such as questioning history of thrombosis, questioning for possibility of pregnancy, and determine serum total, LDL cholesterol before therapy and routinely thereafter. During the time that I am taken, the nurse should monitor serum, total cholesterol, total calcium, inorganic phosphate, total protein, albumin, bone mineral density, and platelet count. Diligently monitor for CVA, DVT, pulmonary embolism. I should not be discontinued 72 hours before and during prolonged mobilization. Therapy may only be resumed only after patient is fully ambulatory. After I am taken, the nurse should conduct a patient or family teaching. The subjects are as follows: avoid prolonged restriction of movement during travel, take supplemental calcium, vitamin D if daily dietary intake is inadequate, engage in regular weight-bearing exercise, modify, discontinue habits of cigarette smoking and alcohol consumptions, report symptoms of DVT, lung embolism, stroke. Thank you for listening, and I hope you all have a good day.